My name is Agampreet Kaur.
Hi, my name is Aubrey Taylor.
Hello, my name is Claire.
Hello, I'm Jocelyn Stanley.
Hi, my name is Maurice.
Hello, my name is Miranda Vasquez.
Hello everyone, my name is Ridley.
Hi everyone, I'm Sophia Malone.
And I'm Mr. Grisham.
And I'm Mrs. Grisham.
Welcome to Pharmacy Success
2024-2025.
A typical day usually starts off with me getting over to credentials and then heading to production and pulling for production, which is basically where I just basket up any of the prescriptions, or either they're already basketed up and just pull, just walk around either in slow movers or over the counter or in fast movers and get what type of drug I need matching the NDC. Sometimes I even go over to insurance and deal with third-party claims, rejections, or anything insurance related. Or sometimes I even get to dispense medications, or sometimes I even get to file, which is just all the medications that have been ready to be picked up and just put them in the right bin so that when people come to pick them up, we can find them easily.
When I first get into the pharmacy at 12:30, I usually unload Centerfill. It's our off-site pharmacy that fills for us. When you're filing your prescriptions, you want to make sure that you're doing them fast, but also properly so that it's not hard to find later on. Before lunch at 1:30, I make phone calls. I make them for people that need to pick up their prescriptions, they're due for a refill, or I make opportunity calls, which are people that are due for their vaccines. In my downtime, I try to chirp patients, which is where you check what vaccines they are due for and mark them down on a paper and staple it to their prescription so you can mention it to them at checkout. Because at Walgreens, one of our big goals is to try to get a lot of vaccines throughout the year. When we get back from lunch, I fill prescriptions. I don't do this every day, but it definitely is my favorite task. It's nice to learn about the medications because typically I try to look at the back of the leaflet where it says the common use for the medication, so that does help me learn a lot of the medications. I really love the staff I work with, especially Joni and Laura. Whenever I ask them a question, they're always so kind and answer it in the best way possible. And I'm really sad that soon it will be coming to an end. But yeah, this is my day at Walgreens.
So as far as Walgreens go, my role here is kind of just like filling prescriptions. I do drive-through sometimes. I've been outdating a lot lately, so expiring medications is a big part of both pharmacies. This is what I've learned from both my time here and at Johnson Memorial. I spent a lot of time outdating. Johnson Memorial didn't have an ADM, but this location does, and cleaning the ADM is very time consuming. You have to go through it and clean every cell, and cleaning is also just a big part of pharmacy because you have to, keep the medications clean. So that's something. I've learned a lot from Walgreens in Pacific, and Johnson Memorial taught me a lot too. But here in Pacific, I've learned kind of what a retail pharmacy setting looks like. So I'm not just running between Pyxis machines like I was at Johnson Memorial. I'm filling a lot of prescriptions here. I'm very hands-on and firsthand involved in the medicines. So I'm filling a lot. You have to go locate it on the shelf, and which can be a little bit confusing. The medicine is definitely confusing when you first start. So I would advise going easy on yourself, because when I first got here, I was a little bit worried about not being able to find the medications as fast as some of the people who work here could. But just ask questions. Always ask questions, and they will tell you. The people here are delightful, and the people at Johnson Memorial were delightful. But anyway, so some of the skills I've learned a lot about like first-hand filling prescriptions and going through the machine and learning what insurance creates exceptions for and what it doesn't in terms of like partialing and changing manufacturers.
I have a variety of roles. I manage inventory, process prescriptions, and interact with customers. A typical day as a pharmacy technician involves a lot of things, including filling prescriptions, managing inventory, and assisting the customers. The responsibilities also include verifying medication orders and ensuring that all operations comply with health regulations.
And what I do on a daily basis is first I turn using the Pixie billing device. I pull all the medications needed for the cases and deliver it across the hospital, usually upstairs and the second floor. And usually I will deliver about 10 medications to each Pixie, which is about 4 in total. So about 40 medications on a normal day. And after that, I would come back here, and it would be around 2 o'clock when I get back. And that's when we start printing patient medications, like patient-specific medications they deliver. This is different from Pixie medications. We deliver these all across the hospital, not the second and third floor. Sometimes we have to go to oncology, which is a cancer center. Sometimes we have to go to ER. And sometimes you can have to go to C-section where you have to gown up in like face mask, hair nets, the white gown, and booties for your feet. And you would have to put the right patient medication in the rack so they can then administer it to the right patient. And on some days, we would have to do inventory checks where we have to check for any expired medications or anything, stuff that has gone bad and that we can't administer to patients anymore because they've lost their potency or they could be dangerous if you administer it. And we take it to a expired room full of expired medications, and we would just keep them in there until it's time to empty it out, and we either send it back or we completely discard of it. And this usually happens about once a month, so I've only done it a couple of times. Another thing I do is pull fluids. There's a fluid room about down the hall to the right where we have like stuff like lactated ringers, normal saline, dextrose 5%, and water in carbon solution that we also deliver to the Pixies and patient-specific medication at other centers. Usually we would have lactated ringers, normal saline, and dextrose 5%. Nothing too crazy.
A typical day at the pharmacy consists of printing labels, filling prescriptions, taking medications, compounding,
What I do, basically, I'm here. This is my station. I'll throw my pills onto here and I'll count them. I'll flip it into a bottle, which I can grab from down here or over here. I'll scan a leaflet and then I'll print a label over here. I've definitely had some challenges, like counting. This can help you. This is a scale. First you click sample, but you put 10 pills in here and then you click print. And this will help you count a large number of pills. One of the issues that I've had is how to change a manufacturer or how to partial fill something. You come over here, you type in the patient's last name, the first 4 letters of their last name, you go to their prescription, you can, over here, you can click partial fill, which is down here. And then when you pull up the prescription, you can hit Command M, and then you can change the manufacturer. We have some cool features in the pharmacy. Here's our Fast Track, which is right above where we are, so it's really convenient. And this is our cell machine, where we can scan the patient's barcode here, and then it'll dispense from here. All you have to do is take a bottle, and you push it from here. We also have refrigerators, like right here. This is where we keep all of our insulin and stuff. And through here, this is where we have all of our medicine.
Really, I go to rotations every day from 12:30 to 4 o'clock. Of course, you should always get there at least 10 minutes early just to leave a good impression on your site as you are a student from an outside program. The first few weeks will always be spent doing introductions, getting to know your pharmacy, the people who work there, and usually each day your preceptor will have certain activities and certain lessons planned for you to learn the ins and outs of the pharmacy. Here at CBS, we're a very busy pharmacy located in so we get a lot of prescriptions. So the first mainly 2 weeks for me were spent learning the kind of everything to know when it comes to filling prescriptions and inventory, just because that's where a lot of our work in the pharmacy kind of lies in. So now that I'm kind of reaching the end of my rotations, I kind of have a set routine for myself. Every day I come in, I will always put prescriptions in their designated bins so that they're ready to go when patients come in. We usually have a lot of those done since I would say a bulk of our prescriptions come in the morning, so those are usually ready to go by the time I get in. Then I will take care of our return to stock medications, so we will have a list every day prepared with medications that need to be pulled, so I will take care of those, and then I will go through the process of checking them out on the computer. Once that's all done, then I usually sign in on the computer to the QP or the production queue, which is where you will spend your time filling prescriptions. This is pretty general for all sites having a QP, so as you kind of start learning the ins and outs of being a pharmacy technician and you start getting more hands-on experience, you'll definitely start to see a lot of similarities and also a lot of differences between each rotation, which is always really cool and super interesting to see and ask questions about. So usually I will sign in, get my credentials, and then start filling. One thing I love about being a pharmacy tech is that every day is different. Some days you'll have some really interesting patients come in, or it'll be super busy, or sometimes it's not busy at all and it's very dead, and you have a lot of time to ask your preceptor questions that maybe you've had come up that you haven't had time to ask before. So it's just really cool because it doesn't ever get too static in what you're doing. It's always different, and that's what I love about being part of KLR, is that you go through 4 rotations your senior year if you're starting out as a junior like I did, and each rotation is really a different experience.
One of the challenges that I faced here is with insurance. And it's just where the insurance rejection was delayed. It was a delayed patient prescription, and it first was really overwhelming just to know and just figure out why and how it's going to be solved and why it's getting rejected. But as you go on and as you figure out all the codes that are needed to figure out why it's rejected and you gather all of the necessary documents, it gets really easier on you.
As far as challenges that I've seen here, Walgreens has been really smooth going, and I was honestly expecting the worst when it came to customer service, but the people here are great and a lot of the customers are very kind, and I haven't had a problem with that really. I haven't overcame much because I haven't had that many challenges. The biggest challenge that I've experienced overall is just finding the medications and learning the new organization system between the two different locations, because that is definitely the biggest difference and the biggest problem you're going to run into when you first start filling is the locations of medicines. It can be really hard to get down, but it just takes time.
One of the unexpected challenges I faced was dealing with customers. when they would get upset and impatient, it would alter my mood, and I would start to get affected by it and feel what they were feeling. To handle this, I used my village, which was my team, and they helped me tremendously. I communicated my issue to them, and they helped me through it and gave me some advice on how to handle the situation next time. We also did like not mock interviews, but we did like little like scenarios, and they would be the customers, I would be the pharmacy tech, and I would work my way through it, and they would help me through it, and they would give me feedback on what I did correct and what could change.
Definitely one of the challenges is figuring out the layout. Figuring out the layout may be hard, but it's all in alphabetical order most times, and then you have certain places where you see your typical box medications, like right here, instead of pill bottles that you have to count. All in all, it's a really good learning experience if you want to be a technician. Your best friends are your staff and your pharmacist.
You will come across a lot of challenges. Obviously, as a student, you're not as experienced as your preceptor or the people that you're working or collaborating with. So there will be times when you have questions or you're scared to mess up. But the beautiful thing about being a student is that the people around you are here to answer your questions. They want to help you become a better pharmacy tech and also just better your skills in the workforce. So always be asking questions, staying curious. You're here to test their knowledge basically, and they love that. So just really be open-minded and ready to learn.
Some advice that I would like to give to juniors is to just be prepared to multitask. And just stay organized, and you'll learn a lot just by doing something. You don't just want to not do anything, and you don't want to expect yourself to learn like that. You do want to do dispensing, insurance. I'd say for someone who is starting off to be a pharmacy tech, to know your insurance terms.
My advice for juniors would just be, I think I've already said it, but I feel like it deserves for me to restate it. Just ask questions, because it's going to be confusing and it's going to be difficult, especially locating medicines. Every time I still, even though I've been here for almost the entire semester or the entire 9 weeks, still is not easy sometimes to find certain medications. Things are in weird spots and the system isn't always right, and you always just have to be patient with yourself and with the employees, and it's a little difficult, but you'll get there, and you need to not be so hard on yourself, because I was really hard on myself the first couple weeks that I was here about not finding things as quickly as some of the other technicians. But just ask questions and you will get there, and remember in the end that you are also new to this, and everyone here knows you are new to this, and so they will be patient with you. I have yet to run into a negative experience when it comes to the employees at both locations, especially at Johnson Memorial. They were very, very kind.
Advice I would give to juniors entering this role next year is that they should expect a fast-paced environment that requires multitasking and a strong attention to detail. To prepare, it's beneficial to practice and remember pharmacy terminology and practice good communication skills to interact effectively with both customers and your colleagues. It's also very important, I cannot stress this enough, y'all. Y'all have to pay attention to them quizzes and the assignments that your instructor will provide you. It's very beneficial, and it'll get you through everything. Study, take notes. When they tell you to write down things, do it. They're not playing. And half of the stuff that we go over on our classes are on the quiz, like word for word. So all you really have to do is pay attention. You have to lock in and study, get everything done. And if you have questions asked, they're very nice. My instructor, Mr. Grisham, love him dearly. He communicates very well. He answers all the questions. He's a great instructor. Y'all need to but it's very fun. I had so much fun this year, and having this experience I never got to have before is very amazing. And now I'm a certified pharmacy technician.
You always want to ask questions to them, and that is my best advice to you. And also another good piece of advice is exploring. You're here to help, and you're here to learn. So always look through here. And learn where your stuff is. This will help you in the long run. My best piece of advice is to always rely on your staff because they're some of the best people, and always your pharmacist. Do not be intimidated by them. They're really nice people and they're here to help you, and you're here to learn.
Thank you and congratulations to all of our seniors for making it through rotations and graduating.
We can't wait to see what all of our students achieve next year.